Can stress cause hair loss? If you've been noticing more hairs in your brush or on your pillow during a stressful time, you're not alone. Let's dive into the science behind it. One of the most common forms of stress-induced hair loss is called telogen effluvium. Now, normally the hair grows in cycles with 3 different phases, namely the anagen phase, which is the growth phase, the catagen phase, which is a transitional phase, and the telogen phase, which is a resting and shedding phase. Now, stress can prematurely push your hair follicles into the telogen phase, which is going to lead to shedding. Typically, the shedding starts a few months after a stressful event, such as surgery, illness, emotional distress, and even sometimes lifestyle change. The good news: telogen effluvium is temporary, and if properly treated, the hairs can recover. But chronic stress doesn't just cause temporary hair loss. It can also accelerate the aging process of your hair follicles. Stress increases cortisol levels, which can damage DNA and cellular structures. This speeds up aging, making genetically prone hair follicles deteriorate faster. When stress becomes chronic, it creates a hostile environment for hair growth. Prolonged exposure to cortisol can reduce blood flow to the scalp, limit nutrient supply, and increase inflammation around the follicles. For example, if you have a predisposition to androgenetic alopecia or pattern hair loss, increased stress can shrink those follicles a lot faster and lead to a hastening of hair loss and hair thinning. All of these factors contribute to hair miniaturization, which leads to the hair growing thinner and shorter over time. So what can we do to combat stress-induced hair loss? Here are some practical tips. Number 1, manage your stress. I always preach to my patients to practice good sleep hygiene and to exercise. These 2 things are going to help reduce your stress significantly. Number 2, a healthy and balanced diet rich in minerals and vitamins that are going to support hair growth. Number 3, consider treatments. For those who have had prolonged or severe hair loss, minoxidil, finasteride, and perhaps even PRP can help stimulate hair growth. And number 4, consult a specialist. If you've noticed significant shedding that lasts more than 6 months, or you have visible thinning, it's time to consult a specialist. Early intervention can make a big difference in preserving and restoring your hair. Stress can take a toll on your hair, but with the right approach, you can manage it effectively. If you have any questions, please comment them below and give us a follow if you like this content.